Hello. Today we will discuss the basic retinal imaging, and we will try to cover the findings of the fundus fluorescein angiography in diabetic retinopathy. I'll divide the lecture into three parts. The first of them is what are the lesions that can be seen in the fluorescein angiography in a diabetic patient. The second is what is the diabetic retinopathy grade, and the third is either any maculopathy and which type. So when we are interpreting the findings in a diabetic retinopathy fluorescein angiography, we need to compare the findings to the colored fundus photograph. If we see in the square part in both the colored image and the fluorescein angiogram, there are some reddish lesion in the magnified view. Those reddish lesions in the color fundus photograph may correspond to an area of hyperfluorescence, and this indicates this is reported as hyperfluorescent microaneurysms, or may present with a plugged fluorescence due to retinal hemorrhages, which can be dot or blot or flame-shaped retinal hemorrhages. Again, these this is a blot hemorrhage, which corresponds to an area of blocked fluorescence, and this is an area of hyperfluorescent microaneurysms. This is a flame-shaped retinal hemorrhage corresponding to an area of blocked fluorescence. Another finding that can be seen in fluorescein angiography is the ERMA, or what is called the intraretinal microvascular abnormality. It presents as an intraretinal blood vessel connecting between usually a retinal arteriole and a retinal venule. And when we say intraretinal, we mean that it did not penetrate the internal limiting membrane. Usually, it's adjacent to an area of capillary dropout. We'll know later what's meant by capillary dropout, but usually it is a sign that the diabetic retinopathy is getting worse. And it usually appear when areas of the retina becomes ischemic. The main feature in the fluorescein angiogram that differentiates the ERMA from the neovascularization is that there is no leakage there. So even in the late phase of the fluorescein angiogram, you find that they are very well delineated. As the condition gets worse, there will be some proliferation of diseased blood vessels. These can occur over the disc, and they are called neovascularization of the disc, or we are abbreviated as NVDs. Those blood vessels are very well delineated in the early phase of the fluorescein angiogram. You can see the individual blood vessels, but as time goes on during the angiography, they will start to leak. This means that the fluorescence will start to increase in intensity and in size, and will end up at the late leakage in the late phase of the fluorescein angiogram. So this slide shows a composite image of a fluorescein angiography of a diabetic patient. As you can see in the circle, there are hyperfluorescent microaneurysm. There are some blocked fluorescence corresponding to retinal hemorrhages. There is an ERMA in the circle, which in the magnified view presents as an abnormal blood vessel connecting between a retinal arteriole and venule, and it doesn't leak. The area peripheral to the pulsating shape represents an area of capillary dropout, which is a feature of diabetic retinopathy. As things get worse, and there will be progressive obliteration of the capillary bed of the peripheral retina. We talked earlier about the neovascularization of the disc, but this photo showed the neovascular tufts that are present away from the disc area. Those are called neovascularization elsewhere, or abbreviated as NVEs, and they are characterized by late leakage of the fluorescein angiogram because the endothelial cells of the new vessels lack the tight junctions, which is a feature of the inner blood retinal barrier. So now we will start to discuss how to grade the diabetic retinopathy according to the findings in the fluorescein angiography. The non-proliferative diabetic retinopathy is characterized by the absence of neovascularization, like neovascularization of the disc or neovascularization elsewhere. It is classified into a mild degree in which there are only microaneurysms, or moderate non-proliferative diabetic retinopathy in which there is microaneurysms and other signs like hemorrhages, hard exudates, cotton wool spots, but it's less than severe non-proliferative diabetic retinopathy, which has one of the features of the 4-2-1 rule, either severe intraretinal hemorrhage in all 4 quadrants, venous beading in 2 quadrants, or ERMA in 1 quadrant. In the flourescien angiography, the feature of extensive areas of capillary dropout is an additional feature to the clinical findings that are mentioned in the NUM-PDR scale. And severe non-proliferative diabetic retinopathy is represented by presence of 2 or more of the 4-2-1 characteristics. Regarding the proliferative diabetic retinopathy, it's subdivided into either a simple PDR, in which there are findings of severe non-PDR with 1 or more of the neovascularization of the discs or neovascularization elsewhere, or presence of vitreous or preretinal hemorrhage. And we have the high-risk PDR, in which there is an extensive neovascularization of more than 1/4 to 1/3 of the disc area in case of NVD, or any neovascularization of the disc associated with preretinal or vitreous hemorrhage, or any neovascularization elsewhere associated with vitreous or preretinal hemorrhage. So if we will take this flourescien angiogram as an example, we can say that there are several hyperfluorescent microaneurysms. Some of them are present in the macular area and some are outside the macular area. In addition, there are several areas of blocked fluorescence, mostly corresponding to dot and blotch-shaped retinal hemorrhages. These findings goes with the diagnosis of moderate non-proliferative diabetic retinopathy. So if we look at this fundus flourescien angiogram, we can say that there are several hyperfluorescent microaneurysms. In addition, there are several leaky neovessels. Some of them are present near the disc, and those are called NVDs, as shown on the left-hand side of the photo. And some of them are present away from the disc area, and those are called NVEs. In addition, we can detect that there are extensive areas of capillary dropout that are present in the peripheral retina, and those are appear as loss of the grayish color of the peripheral capillary bed. So this case classifies as high-risk proliferative diabetic retinopathy. Now we'll move to talk about whether there is maculopathy or not, and which type. So when we are evaluating the macula on flourescien angiogram, we need to look first at the colored fundus photo as shown in the upper photo, and at the red-free photo as shown in the lower one. And then we need to look at the early phase of the angiogram and another macular photo at the late phase. As you can see, there are several reddish lesions in the macular area. Some of them corresponds to hyperfluorescent microaneurysms, and some corresponds to blocked fluorescence due to hemorrhages. Again, there is another tuft there in the inferior nasal part of the macula, and a third one in the inferior temporal part. This will make us grade the condition as multifocal leakage maculopathy. In addition, we can notice that the foveal avascular zone here is enlarged and a bit irregular, and this is graded as ischemic maculopathy. So in conclusion, we can say that this patient has multifocal leakage and ischemic maculopathy. On the other hand, we may have another type of hyperfluorescence in the macular area, or what we call leakage maculopathy, but in this type there is no individual leaky microaneurysm or a tuft of microaneurysm. Here, all the capillary bed in the macular area is a bit leaky, and this is graded as diffuse rather than focal leakage maculopathy. In conclusion, when we are writing a report for a flourescien angiography in a diabetic patient, we need to mention the lesions that we could detect, and then we need to grade the diabetic retinopathy, whether non-proliferative or proliferative, and which stage, and then we need to comment on the macular area. Thank you for your attention.